name is Ronnie Decker. I am a registered nurse, and this is Nursing Analysis. Today, we will be discussing hygiene and activities of daily living. Hygiene can be defined as conditions or practices conducive to maintaining health and preventing disease, especially through cleanliness. We as nurses help enforce proper hygiene with our patients by assessing the patient's self-care ability. Activities of daily living are the individual tasks a person must be able to perform on a daily basis. These tasks include feeding, toileting, transferring, dressing, and performing hygiene and mobility. We will also talk about instrumental activities of daily living. These are not considered essential for basic function. However, they do give a person independence. These activities include managing finances, using transportation, telephoning, cooking, doing laundry, shopping, and performing household chores. As nurses, we must know the ability of the patient to perform their ADLs in order to know how to give appropriate care. We fill in for what the patient is unable to do and promote what they can do. The optimal goal is to promote activity, independence, and self-esteem. There are several factors that can influence a person's hygiene practices. We must respect all patient preferences and differences. Do they prefer a shower or maybe a bath? Do they prefer it in the morning or in the evening? We must even give thought to the bathing products when considering preference. Remember, culture and religion or spiritual values form the foundation for our beliefs. Daily bathing, use of deodorant, and brushing teeth to eliminate body odors is a North American necessity. Some cultures do not participate in bathing at this pace. We also must provide same-sex caregivers when a person's culture dictates this belief. The economic status and living environment must also be considered because it can also influence hygiene needs. Lack of supplies, including running water, are things we must consider in relation to cultural beliefs. Food and shelter are usually the priority factors for people living in poverty. The nurse must be aware of the developmental level of the patient being cared for. As for the older adult, we know frequent bathing can dry the skin because the sebaceous glands do not promote enough oil to keep the skin moisturized. For these patients, we need to consider their preference of bathing less and adding skin moisturizers to compensate for any dryness. Let's now discuss factors, both physiological and emotional, that can interfere with the ability to perform activities of daily living. Pain. Pain can limit mobility, which can contribute to self-care deficits. Even with the inclusion of analgesics to manage or combat the pain, we must consider the effects of pain medications, such as drowsiness, as another mobility restraint that will further the self-care deficit. Some patients' mobility can become limited due to joint and muscle problems, injury, weakness, fatigue, surgery, and ordered bed rest. All of these conditions can hinder hygiene activities. Medical equipment such as IV lines, NG tubes, catheters, or even casts can also interfere with self-care. We must also consider sensory deficits that can contribute to immobility. These include visual or hearing loss. Nurses must provide understanding, direction, assistance, and even written instructions for these type of patients. Cognitive impairments like dementia, delirium, psychosis, stroke, or brain injury can interfere with proper grooming. The patient may have no concept for the need for hygiene. These patients may be fearful or even resistant to care. The nurse will need to provide these patients with simple step-by-step instructions. We may need to reapproach these patients if the resistance becomes persistent. Depressed patients may neglect their hygiene because they no longer have the energy or motivation to perform these activities. We must always remember to plan hygiene care around the patient's needs and preferences and not around staff convenience. So, what is a self-care deficit? This is when a patient is unable to perform one or more ADLs. A nursing diagnosis related to hygiene would include self-care deficit related to neglect of ADLs. Delegation. Delegation of hygiene care. The nurse must first accurately assess the patient to ensure delegation is appropriate. If the patient is unstable or the UAP is inexperienced or unfamiliar with the patient's limitations, the nurse must assist or perform the care themselves. The nurse is responsible for informing the UAP about any patient limitations, presence of medical devices including tubes, catheters, or bandages, and any assistive devices such as walkers, canes, and gait belts, and how to use or maintain them. While providing care, include any observations such as skin condition, bony prominences, presence, appearance, and amount of any urine or stool. Remember, these responsibilities are individual tasks that can be delegated to the right person if it is the right task for them and it is the right circumstance, as long as you provide the right direction and or communication with the right supervision or feedback. The nurse should consider assisting the UAP, as this is a good time to assess the patient's level of consciousness, memory, ability to follow instructions, range of motion, skin condition, activity tolerance, and self-care abilities. Let's briefly discuss the CAT-2 Index of Independence and Activities of Daily Living. This is a tool which nurses can use to assess the functional status of older adults by measuring their abilities to perform activities of daily living. It focuses on bathing, dressing, toileting, transferring, and feeding and continence of the patient. So now it's time to spice things up. It is time for our Rhyme Time Review. Hygiene is what the nurse is teaching and giving. including all the tasks included in activities of daily living. Observe your patients and report what you see as you verify each of their self-care abilities. We need to promote these tasks to prevent stasis, as most of these tasks are performed on a daily basis. We help with the tasks that only the patient cannot do, and we stand beside until these activities are through, especially when the task presents as new. Allow them to complete the task that they are able to do. Utilize the whole healthcare team while supporting patient independence and self-esteem. Consider their culture, which dictates how driven, the importance of these tasks related to their religion. Consider the patient's age and always remain close by, and do not forget skin moisturizer as the skin becomes dry. Provide a woman for a woman and a guy for a guy. This should be included as you gather your supplies. Treat your patient before beginning if you do not want them to complain, as no one deserves to endure any sort of pain. When giving medication, we watch for its peak, as it may make our patients lethargic and weak. Observe them closely and do not forget to adjust your plan for any self-care deficits. After we completely assess, we determine what is best, handling major tasks and delegating the rest. Just make sure they are able and the patient is stable. Give the UAP a proper introduction with each step-by-step instruction. And if you wish, it would be helpful to assist, giving you a chance to detect anything missed. And when assessing your patients with all of your checks, remember to utilize the CATS Index. Thank you for taking the time to learn with nursing analysis. If you want to see more great educational videos, please like and subscribe to support the channel. Please leave any ideas or suggestions that you might have for a video in the comment section below. From fevers to runny noses, a nurse is there. If you need a helping hand or just a hand to hold, a nurse is there. Whether a baby is being born or a life needs saving, again, a nurse is there to help. Learn how to provide the compassionate and dedicated care that patients need. Let Medical Prep Institute prepare you to be the nurse that is always there. Contact us today at 1-813-932-1710 or email at info@mpied.com, and we will help you obtain a rewarding career in the medical field.